everybody. I'm Berni. Alcoholic. And I'm not speaking at a meeting, so I actually have notes, because that's unusual. So I wanted to start out by expressing my gratitude for the people that put just this Wellness Day event together, because this has all happened without me even knowing it, okay? So I really just want to give them a round of applause. Let's just do that. And there's, you know, some key people here: Dr. Stephen Danziger, Gina, we've got Amanda, Johnny. I'm invariably going to miss other people. I mean, there's a whole wellness team, and I'm just so impressed with the level of just professionalism and just attention to detail. And I want to thank you guys so much for putting together this amazing, lovely event. And this will be our second one. So, what can I say about working in treatment, and what I can say about, you know, my vision for 180 is, I'll start out by saying I know what doesn't work in addiction. I've worked at some of the top treatment centers in California. I was at Promises, for example, for about 8.5 years. As Steve said, I really literally did everything. I've been, you know, a tech. I've been, you know, as he said, the aerobics teacher. I would be known to, like, do dishes and blood pressure simultaneously sometimes, if needed, you know. I learned from the ground up. And so in terms of building a center, it was really important to me that my staff comes from a place of, you know, real humility and integrity. And I can tell you that everybody here at 180 is handpicked, with that being that everybody here is really passionate about what they do. So just to talk a little bit about how my treatment approach, you know, how I envision it going forward. I worked, again, about my history with tons of relapsing heroin addicts. I mean, that's what I was known for. Anybody who's been in this field invariably that knows I've sent them a referral, they're like, yeah, it's a Berni referral. You know what I mean? Like, yeah, I'm not so sure. I don't know if I want to take it. So I don't know what this is going to be. Because I'm notorious for having the super traumatized, relapsing, out of control, that nobody else wants to deal with person in my office. And, you know, it took me a really long time to figure out what the heck to do. And I ran into somebody a while ago who said, you know, in my journey here, who was like, well, I do EMDR, and I'm like, that's really weird. Doing the whole, like, waving your fingers in front of their face things, not so much for me. I don't think I don't think it's going to work out for my clients. But what I ended up doing was, in my own life and in my own recovery, I tried doing EMDR as a patient. And through that experience, I had to get to a place where I thought, I have no choice. I have to go become an EMDR person. Because talk therapy is so limited. And particularly when you're dealing with addiction and people's inability to self-soothe and have the self-regulatory skills. It was really apparent to me that without utilizing other therapy approaches, that I was going to have my hands tied. So I've come to find that the cross-section between addiction and trauma, they're married often. As Dr. Shabrasi was saying, you know, without really knowing and treating the central nervous system and the self-regulatory mechanisms, you don't get better. because drug and alcohol addiction, in my opinion, is really about the lack of those skills, often based in early trauma. So I am obviously an EMDR certified therapist. I've had the honor and luxury of having some of the most talented mentors in my experience. Namely, I just have to say it, Andrew Leeds, who wrote the Resource Development Installation Protocol, and I utilize a lot of his skills and do have the honor of being able to pick up the phone and get him on the other end often, which I do. So here, you know, out of my experience of working with this really difficult population, I also utilize equine therapy. I happen to be a horse person. I grew up here in LA, and weirdly, you know, was able to ride in Griffith Park. You know, I've had the experience of riding up until I hit 16, which, you know, I found cars and boys, and horses went out the window. But I, in my own recovery, had a horse in my life again. And through that, I am also an EGALA certified equine therapist. And what that means is that I utilize horses often in my trauma work and in my addiction work here. You know, because horses are herd animals, they are flight animals, and they're able to read energy really, really well. And if anybody had seen that, I just got the opportunity to see the Buck documentary. I was like, oh yeah, you know, you're speaking to this, what do they say, singing to the choir kind of thing. It's something I really believe in. And here at 180, we are individualized. And a lot of people say they're individualized, but I'll tell you what, very few people are actually, you know, can use that word and mean it. We have a 3-to-1 staff ratio. We are completely, based on what the person is bringing in, we tailor the treatment around that. There is no cookie cutter thing happening here. Our scheduling department, we've got our clients here at 180 go in 14 different directions depending on what they need. If you see our computer screens, it looks like the Matrix. They've got everything from yoga to anger management to they're going to go see Dr. Shaparazzi. They're going to go, you know, do some somatic experiencing. I mean, it is literally 4 different directions. And so we work really hard at that, and we need a huge staff to do that. And I'm honored to say that we have that. We also are big believers in the integrative approach and the idea that we want that person to be exposed to all their triggers within their recovering environment if possible. We are not big believers that the isolationist model works. I used to, I've done it, you know, the 30 days on an island idea, not so much, okay? Because what happens the minute, and particularly with the clients I work with, notoriously, they're having cocktails on the plane back, okay? They are on their cell phone with their connection within 5 minutes, okay? So the whole idea of keeping people away from their lives in order to get sober, in my opinion, it doesn't really work. I believe in what's called like in vivo desensitization. People need to know how to be in life and stay sober as opposed to out of their life and then being flown back into it. That, in my opinion, is a shock to the central nervous system. What I believe is while you're here, go through the feelings, get the cravings, see what it feels like to use your cell phone sober. Tell me about what's going on with you. Let's find alternatives, but let's be hands-on while you're in the process. I don't want you to be by yourself looking through a meeting directory at the ones that are highlighted by the treatment center and you just left. I want you to already be in those meetings when you're discharged. We believe in integration, not isolation. That's our mantra here at 180. And I realize, I know Alex is going to talk for a few minutes too, so I don't want to take up all this time here, but the other thing is we have a varied length of stay. There is no magic number. The 30-day model was invented by insurance companies, okay? The idea, I don't know who came up with this, that 30 days is like, you know, the Holy Grail, is the most absurd idea ever. I have patients that have come in 10 days and they're still sober. I have people that stay 8 months. You know what? It really depends on what's on board. And what we do is we're really heavy on the assessment end, because that helps us determine what exactly we need to plug in. And there's always a trauma assessment. Upon admission, that's really critical. We want to know what's going on holistically on all angles. So we also are big believers in people utilizing their own therapists and their own treatment teams. We work really closely with outside providers so that we like to bring you into the 180 team. So if, for example, if a therapist brought in a patient, what we do is we make you a part of our treatment team. Each patient here has a weekly treatment team meeting. That means they're going to be meeting with their primary therapist, their case manager, their psychiatrist or doctor, and whoever family member or person. We meet weekly with the patient, and together we put our heads together and say, what's working, what's not working. That treatment team keeps the containment, the safety for the patient. So we're really big on doing that. We're partnered, I'm honored to say, with the doctors at UCLA. We utilize a lot of them. But we also utilize Golden Bridge and the yoga therapists like Vermouth. And Get Love is, you know, I'm really honored to say that we work really closely with them. We go and feed the homeless every Tuesday morning here. Jimmy Ritello, Dr. Dubin, these are some examples of our holistic healthcare providers. And the one thing I want to just close on is, first and foremost, what I hope and want for 180 is to provide safety. Because for the first time in people's lives, and particularly when you're treating addiction, without safety being the cornerstone, there is no going forward. There is no recovery. There is no work to be had. So first and foremost, 180 creates an environment of safety and just the ability to be able to, you know, start somewhere. So with that, I just want to thank you all for coming, and that's all I have.